traditional healers and the mental health professionals. In addition to his academic profession, he has successfully established the first community psychiatric clinic with crisis intervention service, an endeavor that effectively contextualizes psychiatric care within the Ethiopian cultural framework. Further information about his innovative clinic can be found on the website www.sitopsy.com. You can cite this website. Outside his academic and clinical work, Dr. Yonas actively engaged with various organizations. He currently serves as a board member for the Ethiopian Mental Health Society and the Association of Women's Psychiatry in the Development in Ethiopia. Through his involvement, he advocated for the reduction of stigma surrounding mental illness and strive to develop cultural and religiously sensitive psychiatric service across the country. Dr. Yonas holds a master's degree in medical education and has obtained a subspecialty certificate in child and adolescent psychiatry. His extensive expertise, coupled with his unwavering commitment to inclusive mental health care, positioned him as highly esteemed and respected profession in his field. Additionally, Dr. Yonas has authored an educational book specifically tailored for family members living with a child diagnosis with autism spectrum disorder. This publication serves as a valuable resource, providing guidance and support to families navigating the challenges associated with his conditions. I hope Dr. Yonas will share us different aspects to the on psychiatry aspect today. I'm getting it from Ethiopian Medical Association. Initially, the moderator was Dr. Engida Girma. Unfortunately, couldn't join us. I dive in just to moderate. Thank you for your attendance. I will give the floor for Dr. Yonas. Dr. Yonas, you can proceed. Have a nice time. Just for the participant, you ought to attend all the sessions, and at the end of the session, there will be a Google link which will be shared with MCQ questions. You are expected to answer at least 50% of the questions, unless otherwise we may not issue any certificate. Thank you very much. Dr. Yonas, you can start sharing your slide and continue your presentation. Have a nice time. Thank you.
ይሰማል?
ይሰማል ዶክተር። አሁን ዶክተር እንግዳ ገብቷል። ዶክተር እንግዳ you can take the floor. Dr. Yonas, you can continue. Thank you, Dr. Engida. Just I jumped in because we are a bit late with 10 minutes. That is why I dive in. Dr. Yonas, continue.
ሼር ለማድረግ ስላይዱን
ሼር ስክሪንም ሼር የምትላለች ግሪን አሮ አፕወርድ አሮ አለች ሼር የምትል ሎየር ባሩ ላይ የታችኛው እንትን ካርሰሪን ላውላ ስትወስድ ያመጣልሃል። ግሪን አሮ ሼር የምትል
ኦኬ
ግሪን አሮ አመጣልሃለች ዶክ
ግሪኗ መታለች፣ ግን ሼር ስለው ሌላ ነገር ነው የሚመጣው። እምቢ አለኝ። to
መጀመሪያ እንትኑ ፓወርፖይንቱን ክፈተው።
okay, and there go. Okay.
ይታረጋለህ።
አልመጣም አይደል?
አልመጣም። ወይ ድሮፕ አድርግልኝ ቻት ቦክስ ውስጥ እንትን ውስጥ እኔ ዲስፕሌይ ላድርግልህ። ቴሌግራም ላይ ላክልኝ።
በቴሌግራም ላይ ድሮፕ አደርግልሃለሁ። እስከዛ ሞክረዋለሁ።
Or Dr. Yonas, you can share the slide with me and I can help you.
ለጌትነት ልልክለት ነው።
እሺ ግን ለጌትነትም ልከለት
ለአንተም ልላክልህ በቴሌግራም
ፕሮሲድ ለማድረግ ትቸገራለህ። እያንዳንዱን ስላይድ ለማስቀጠል ትቸገራለህ።
ኦኬ ለአንተ ልላከው።
ምክንያቱም እኔ አብሬህ ስለምሆን እያንዳንዷን ስላይድ አስቀጥላለሁ።
ኦኬ ለአንተ ልካለሁ እንግዲህ።
እሺ አይ እንትን ለፈተና ለመውሰድና እዚህ ትወስዳለህ? ያልወስደው እዚህ ላይ ይመጣል። Been 20 minutes.
Okay, thank you very much, Dr. Getinat, for a kind introduction and warm welcome to all the participants for this CME webinar. I'm excited to share my insight on bridging holy water healing with biomedical practice in Ethiopia. Whether you are joining me from the comfort of your home or at the office, just remember, in person or virtual, we are all just one coffee ceremony away from a great conversation. So we are just near. So this is my title, Bridging Holy Water Healing with biomedical practice in Ethiopia, embedding equity principles in global mental health research. So next slide, please. So I want to start my discussion with a case. So a man named Samuel, a 32 years old, lives in Addis. He grew up in a very religious Orthodox family, and from young age, he was taught that faith could heal all his illness. But as he became an adult, he started to experience symptoms of schizophrenia, like hearing voices, having strange thoughts. Desperate to find help, Samuel started to visit different holy water sites, including St. Mary holy water sites, St. Michael holy water sites. Many people in his community believed that holy water could heal both his physical and mental health problem. One day, after a very serious episodes of schizophrenia, Samuel went to a holy water site. Unfortunately, a group of people attacked him and thinking he was bringing bad luck to holy water sites. He ended up with a broken arm and a lot of emotional pain. So finally, Samuel came to my clinic. He was shaken and in pain, both physically and emotionally. So as he shared the story, tears filled his eyes, and he just wanted someone to understand him. And he said, I thought I could find help in my face, but instead I found judgment and violence. So Samuel's story is important because it shows us that stigma surrounding mental illness, especially in religious communities, and many people like him suffer in silence and believing their faith is not enough. So they feel punished for their condition, and a place of worship, which should worship place also should be always safe. That was my expectation, and so Samuel's story has truly inspired me. It shows how important it is to work with holy water priests and help them understand mental illness and as a real medical condition. People with mental health issues deserve compassion, not physical abuse or verbal abuse. So seeing the harm caused by stigma and abuse, especially for someone like Samuel, drives me to engage with religious healers. So I decided to advocate for mental health awareness in faith communities. So we should ensure that churches and mosques are welcoming and understanding place for those who are struggling with mental illness, including schizophrenia. So this is the first story that inspired me to work at a holy water site. Next slide, Engida, please. So another reason why I inspired to work with religious healers is that they are the main source of mental health care in many African countries. Many people in Africa rely on religious and traditional healers for mental health support. WHO says that 80% of people go to traditional healers for health care, and out of this, 40 to 60% are seeking help for mental health issues, especially in rural areas with fewer resources like Ethiopia, which has over 120 million people. And a common treating mental illness is the use of holy water by Orthodox Christian priests. Next slide. Yeah. So another reason that inspired me to work with religious healers is in Ethiopia, there is a strong connection between faith and mental health. So about 43% of people are Christians, but many visitors to holy water sites come from different backgrounds. Many people believe that mental illness comes from evil spirits. So holy water is often used to help these issues. So most Ethiopians prefer traditional methods of treatment because they have lower stigma, very accessible, cheap. Usually they get it for free. Also, the community around the holy water provides a very good social support. Not only social support, even financial support. So there is a big gap in biomedical treatment with a delay about 38 weeks for the care. So before they coming to us, before they come to a psychiatric OPD, a patient spends about 38 weeks on average. There is a delay, switching from one holy water to another holy water, from one religious healer to another religious healer. So they spent, there is a huge delay. So that's another reason that motivated me to work with at holy water sites. So next slide, please. So it's very important to scale up mental health service. But when we doing the scale up, we have to do it in Ethiopian context. So many people only think about when they talk about scale up, they always think about a biomedical treatment, But we can do more, especially in Ethiopia, in the context of Ethiopia. First, we should try to strengthen the resource we already have in our communities. This can help more people to get support they need. Second, we can use non-specialists like community workers to help with the basic care, to find people who need help. Not only that, we can also share tasks among different workers to reach more people with mental health care. Finally, teaching families about mental health, raising awareness about mental health among the families, among elders, religious healers. All these methods can work together to improve mental health service for everyone. Next slide, please. So worldwide, collaboration between traditional or religious healers and biomedical care is very, very rare. So when I tried to do a literature review, I found out that one in Nigeria, they train traditional healers to recognize mental health symptoms and to reduce the use of physical restraints. A very good practice is in Kenya. They work together to treat depression, combining psychiatry and traditional healing. The other one is our project in Ethiopia. We noticed that the two systems were not working well together. So to change this, we approached the church leaders to encourage collaboration. We organized workshops, shared ideas at each other places, a kind of consultative kind of workshop. This effort was supported by Ethiopian Mental Society and the Psychiatric Department of Addis Ababa University. And this example shows that how important it is to bring different types of care to improve mental health service. Next slide. So we need to improve mental health service from different direction to make them fair to everyone. So it's very important to look mental health service in different ways to ensure everyone gets fair kind of treatment. In Ethiopia, there are many challenges because of a limited resource. So many people don't have access to basic psychiatric care, which makes it very hard for them to get help. So collaboration can help to address these issues. By working together with different groups, we can integrate traditional healing methods or religious healing methods and create some kind of holistic kind of approach to psychiatric care. This means we respect and include local practice that people already trust. So community engagement also is very key. When we work effectively with the community, we can reach more people, provide a better support. So it's important to explore partnership between unusual groups like traditional healers or religious healers and medical professionals. So this can create a new ways to help those who need psychiatric care. By combining our efforts, we can improve equity. We want to reach everybody, ensure that everyone receive the care they deserve. Next slide, please. So this picture captures one of the recent impactful consultative workshop with the previous one, not this one. Oh, okay. Yeah, okay. This one, okay. I'm okay with that. So the picture captures our recent impactful consultative workshop with Orthodox Christian religious healers. During this very dynamic gathering, we engage in deep, meaningful discussion about stigma surrounding severe mental illness and harmful treatment that often result from it. And this workshop was not just a meeting. It's not just a meeting. It was a groundbreaking moment for collaboration between different phase healers and traditional healers. Next slide, please. The next slide. Well, so yes, the previous, the picture. So I want to share my experience visiting different holy water sites. I went to many of them, many places. I want to understand them better. Each site was unique. I found out that each holy water sites were unique. I learned a lot about their rituals, traditions, spiritual importance. When I visited, I noticed that how people interacted with holy water, rituals they performed, and kind of things, and they helped me to see the deeper connections between the community and these holy water sites. Through my visits, I try to understand the meaning behind these sites and how they influence people's lives. And it's also a fascinating journey. And I hope to learn even more in the future. Next slide, please. Next slide. Engida. So before we open the clinic, the outreach clinic at St. Michael and St. Mary Church, Holy Water Sites, we held multiple consultative workshops. So we were also listening religious healers. We tried to negotiate in the workshop with religious leaders, both at St. Mary and St. Michael. This is a very breathtaking meeting, helped us come together and decide to open an outreach clinic within the vicinity of St. Mary Church. So the creation of this clinic near to the holy water treatment site of the two churches. So this clinic is very important because it's used to serve 1,000 patients who live nearby around to the holy water. So the role of holy water is highly respected here. It's not questioned by official health policy, and it's part of many rituals that people follow in their culture. So the creation of the clinic involved church leaders, priests, family members, helpers, and the clinic operates every 2 weeks with a senior psychiatrist, 2 psychiatric residents attending the patient during these visits. Next slide, please. So I would like to share information about our clinic, which was established in 2012. We visited the clinic twice a month, as I said, to serve patients with mental illness who are staying at holy water sites. And in 2017, we conducted a retrospective study to analyze the chart of the patient over 7 years. So the study included a total of 1,808 patients from 2012 to 2019. Here are some of the key findings. 82% of the patients were between the age of 18 to 35. 81% came from the city, from Addis. 91% of the patients completed high school. 83% of the patients were Orthodox Christian, 12.7% were Muslim, and 4% were Protestant. Regarding the duration of the stay, 68% of stayed for less than one year, and usually around 2 to 5 months, and 25% of stayed about 2 to 5 years. So the commonest diagnosis was schizophrenia, followed by substance abuse. Next slide. So the unique finding from this retrospective study was we discovered 6% of the patients were directly referred from the priest, from the holy water priest. So 30% were brought by their attendants, and 7% came by themselves. This means that a total of 46% of all referrals came through a brand new pathway. The other 54% were referred by family person. It is interesting to note that 88% of the patient had their first ever treatment contact at non-biomedical site, while 12% of started at a biomedical site. So when we looked at a previous biomedical contacts, we found out that 89% of these patients discontinued treatment, and the reason for this were mostly side effects of the medication. 55% of the patients, they reported they discontinued the medication and came to holy water because of the side effects of the medication. 20% of the patient reported because of the cost, a cost of treatment cost, they discontinued a biomedical treatment and came to the holy water. Furthermore, 71% of the patient reported that they had no awareness or insight into their problem, because many of them are suffering from severe kind of mental illness. However, about 92% of the patient felt comfortable using both holy water as well as biomedicine. In fact, about 91% of took their medication with holy water, and 41% of received a one-to-one counseling from the priest, while 24% of received counseling from both the priest and from the clinic. So this finding highlight the important connection between religious belief and healthcare practice in our community. Next slide, please. Another unique finding from our study, we discovered that the workshops revealed three key aspects. One, mutual respect, mutual learning. We learned from them. We learned from religious healers. We get a support. We supported them, they supported us also. So these elements are very, very essential to create collaboration. So mutual respect, mutual learning, and mutual support. Next slide, please. So people from diverse training, social, religious background can work together to make a dual model approach, biomedical as well as religious approach or traditional kind of approach. So this is important because it shows that teamwork can lead to a better outcome for our community. So we found out that families tend to support and seek traditional healing, and this is partly because there is a residential form of care available that is also very, very affordable comparing to the hospital, comparing to Emmanuel Hospital or other psychiatric hospital. They found out that staying at Holy Water is very, very affordable. This is significant, especially considering the high family burden many experience. Above all, social support from healing sites plays a very critical role in their decision to choose religious healing. It's important to recognize that there is no need to change their explanatory model, nor should we make effort to do so. Our collaboration, we need to respect their belief and practice. So one very important key takeaway here is that viewing medical knowledge and philosophy as superior can create a kind of silo, and that misses an opportunity for collaboration. Next slide, please. We did also a qualitative study. We tried to interview Holy Water priests. We tried to interview senior clergymen at Holy Water. I want to share some key findings from our qualitative study, and I think you'll find them quite interesting. So first, we found that people hold multiple explanatory model of illness. A lot of these are dominated by religious and spiritual understanding. This shows that important of their beliefs are how they perceive health, not only health, as well as mental health too. So it's very important. Then the other important finding, they emphasize spiritual healing, empathic understanding, while also embarrassing biomedicine is as a part of their eclectic healing model. So this means that they see a value of combining different approach to care, which is really very insightful. And another important point that the participants of this study, this qualitative study, is perceives humility and respect from biomedical practitioners as a key positive view on collaboration. If you respect them, if you show humility and respect, you can easily engage them. You can easily collaborate them. So that's another important finding from our qualitative study. It's really highlight how important in relationship are in the collaboration. So they also value recognition of their current role and contribution in providing mental health care, and acknowledging traditional healers is a vital and a fostering better collaboration. So interestingly, participants also of this study, this qualitative study, recognize the effectiveness of biomedical clinics in treating violent and aggressive patients with acute psychosis, patients who are agitated, patients who are physically aggressive. So they really appreciated the treatment. So this shows that they respect the capability of biomedicine. They respect it. They also endorse collaboration to help overcome patient and family refusal to seek care. So it's clear that teamwork can really make difference in health outcomes. So, however, many laments the lack of spiritual healing in biomedical treatments. They want to be involved in our care. They want to involve it in biomedical treatment care. So they want spiritual healing should be part of our treatment. So this indicates that a real need to integrate spiritual practice into a conventional mental health care. So in conclusion, this finding highlights the potential for more integrated approach to mental health care that incorporates both traditional and biomedical practice by fostering mutual kind of respect and collaboration with religious healers. We can enhance the quality of care for our patient. So next slide, please. So we also did a qualitative study. We tried to interview family members. So I want to share some important finding from our qualitative study we conducted on the family and caregivers. This insight really shed light on experience of caregivers and challenges they face. First one is we found out that there is a strong sense of obligation and responsibility among family members to provide care. This is very typical. So typical for Ethiopia. So Ethiopians, they want to care for their family member to death. So they would spend their energy, finance, time, everything. They will give everything. So that was a very important finding. So this commitment is very admirable, but it can also lead to significant challenge for caregivers, especially for family members. So caregiver, as you can imagine, puts serious strain on caregivers' lives and their family roles. And it's not just about a physical task, it's also emotional, financial, time, everything. So the chronicity, the persistency of the illness can really take a toll on a family caregivers and their support networks, including extended family. So this ongoing challenge can make difficult for family to maintain their well-beings. So on a positive note, caregivers often appreciate supportive religious setting and the help they receive from attendant. And this support, they can make a big difference in their life. Interestingly, we found that family caregivers develop a community mutual kind of support for each other while they are staying at holy water sites. So this sense of belongingness can incredibly valuable as they navigate their caregiving journey together. They support each other. They stay at holy water. So family members, they support while they are staying at a holy water. However, there is always severe shortage of formal biomedical services, which limits access for families. Despite this, caregivers expressed appreciation for collaboration in the clinic as they provide much needed support. Finally, we found out, we noted a feeling of burden, exhaustion, and loss of hope regarding the future among caregivers. And this emotion can be very overwhelming and highlight the need for a better support in the system. So in the conclusion, this finding emphasized the importance of acknowledging the challenges faced by family caregivers. These are the pillars of caregiving in mental health. So by understanding their experience, providing adequate support, we can help alleviate some of their burdens. It's very crucial that we work towards improving access to the service, fostering community support, and other financial support to family members who give care to mentally ill relatives. Next slide. So I want to share also some important insight about our effort in bridging the gap between modern psychiatric practice and religious healing, especially among the religious healers in Toto. First, we created a better understanding of mental illness. We try to raise awareness, and we try to also explain the benefits of modern medication, biomedical kind of medication among these healers. And this is very crucial because it opens door for collaboration and better. Next, we established an outreach clinic. So in conclusion, these efforts highlight the potential for more integrated mental health system throughout the country by combining modern psychiatric service, by combining modern psychiatric knowledge with religious practice. We can create a more effective, comprehensive kind of approach in mental health care in Ethiopia. Next slide, please. So, as we so what was the benefits of doing this? We try to we did a study, and we published this article so that the scientific community, not only globally, especially locally, we want them, the scientific community, the psychiatrists, read this article. After reading this article, we want psychiatrists replicate similar kind of approach in their respective areas. We want to psychiatrists in the region open similar outreach clinic, similar kind of collaboration with holy water, with religious healers in different churches. So we published about 4 or 5 articles. One article is on the process of publishing, and so it's very accessible, and psychiatrists can read and learn from this good practice. Next article, next slide, please. These are the article published from this project. Next. So what we did was so the project was mainly focused on the holy water, Orthodox Christians. So we decided to work with Muslim religious healers, who focused on treating mentally ill patients. So using their religious rituals. So we manage also to conduct 3 consultative workshops with Muslim religious healers. As it was groundbreaking, a breakthrough. So I saw a lot of opportunities to work with them. We can reduce stigma. We can significantly reduce physical abuse. Also, I see an opportunity for a collaboration of biomedical science with religious healers. So the next step is we want to work with Muslim religious healers. Next slide, please. Well, so we try to from Toto, we try to go to another holy water sites also. So this is very recently we went to another holy water site and we conducted a workshop there. Next slide. So the conclusion is, as we move forward for our collaboration, so our focus is not only on Orthodox Christian religious healers. We are planning to engage other denominations, including Protestant and Muslim religious healers, and we want to engage them and establish some kind of collaboration. We try to build trust and mutual kind of respect. We try to give some kind of training, raise awareness about stigma, physical abuse. We want to create integrated kind of care model with these religious healers. We want to do research also because evidence is very, very important. We want to produce more evidence so that people can be convinced to replicate. So policy makers can read this evidence and bring some kind of policy change. So we want to raise awareness among the community. We don't stop here. Thank you very much for your attention. This is all I have. Can you hear me, Engida?
Yeah. Thank you, Dr. Yonas, for a culturally informed, practically very relevant, problem-solving and insightful presentation. I hope all the participants share my comment and learned a lot from your practical, very, very practical presentation. So the floor will be open for question and discussion. So far, we didn't get any question on the chat box. Probably people may want to raise their hands and ask question. That's a possibility or an option. Until then, I would love to highlight some very, very important point that you have raised. The first one, which stood out for me, of course, it's known for most of us, is that holy water sites shoulder a huge burden of mental health service, mental health care. So, but we think that just because we have a lot of patients at Emmanuel or at our settings, we think that we are actually the greatest contributor for mental health treatment, but most of the patients' first contact, as you rightly indicated, is traditional healers or holy water sites. So this is very significant, which we can't ignore as people who claim to care for patients with mental illness. We can't ignore this. So you stepped up and you did very important tasks, very important collaborative works. The things that stood out for me, especially in both the qualitative and the quantitative studies, the studies that were published, the consultative workshops, and so on, is that you were very curious, very genuinely interested to know how they do things, how they understand mental illness, how they are intervening, and so on. You had from the presentation, I understand that you had a respectful approach, which is very, very important in collaborating with traditional healers. And the other one is you use scientific methods to inform your activities, did research, very problem-solving research. So this is not a research which is very theoretical and only have a knowledge contribution, but this is something with practical relevance and a bottom-up approach. So you saw the problem in your clinic and then went on and tried to solve the problem at your capacity. So this actually stood out for me. So I think any one of us, be psychiatrists or mental health professionals or anyone who attended this seminar, cannot imagine doing a disjointed service, like disjointed biomedical service on one hand and traditional healer service on the other hand. So you showed us how bridging is very important and life-saving. Thank you for this. So now the floor is open for everyone. You can raise your hand and ask question. So in here, Dr. Asnaka is with me and he has a question, so I'll give him the chance.
Thank you, Yonas. Just to ask you about an update on what's happening with the Muslim religious healers. Any development as of yet?
Thank you, Engida, for a summary. I think you understand me very well. As you said, we think that we are overburdened by mentally ill patients in the hospital. No, what I think most of our patients are at the holy water sites. So if we want to give more service, if we want to give more efficient kind of service, if we want to really to practice, we have to take the service to holy water sites or to religious healing sites. So it's very, very important. We have to open outreach clinic around religious treatment sites. Regarding the Muslim religious healers, So we had 3 consultative workshop, and in these 3 consultative workshop with different to Orthodox Christian religious healers, I found out that the Muslim religious healers were very organized, and because the workshop was a consultative workshop, we also gave them a chance to present about their view of their etiology of psychiatric illness, treatment of psychiatric illness. We gave them a chance to share their view. So I was amazed. They presented, they prepared a PowerPoint. They came. These are highly religious Muslim religious clergies, sheikhs and ustaz. They came with their laptop, and they did a PowerPoint kind of presentation. The presentation was they gave us different perspective, different Islamic kind of explanation for mental illness, and the approach was also quite different from biomedical one. So I was amazed by their organization. So we had 3 consultative kind of workshop. So we visited their healing sites because it's very important. And while we are visiting the healing sites, it's also a very crowded by patients. In one healing sites, approximately there were more than 1,000 patients waiting for the service. So they were so polite. They allowed us to observe the rituals, and they allowed us also to interview the patient after the rituals. So I found out that every kind of psychiatric diagnosis was there. Some of them were suffering from common mental disorder. Some of them were suffering from severe mental illness. And this religious healing sites was not far from one big health center. And in that big health center, 2 mental health practitioners are working. So I went after visiting that religious site. I went to that health center and visited the mental health practitioners. So I tried to get some information there about the patient flow and kind of thing. So the mental health practitioners, she told me that she regularly see patient with epilepsy. Otherwise, she's treating diarrhea, other infectious disease. So she rarely see patient with a common mental disorder. She rarely see severe kind of mental illness. So in nearby, 1,000 patients are getting service from religious healers. So I think there is a gap. There is a disconnection between modern biomedical service and religious healers. So I advised her to work with them and kind of thing. So the plan is we want to continue with them. We are very careful working with them. So the first thing what we want to do is we want them to identify and refer patients to a manual or to other to the nearby health center. And the other issue we as a common denominator, we agreed to reduce stigma, especially physical abuse verbal abuse, other kind of abuses. So we try to raise awareness about stigma, alienation, and discrimination, and maltreatment of patients with severe mental illness. We raise awareness, and they shared our concern. So within their vicinity of treatment. So on our second and third visit, we start to see some change. We start to see less physical abuse, less people are chained. So I think raising awareness, our psychoeducation gradually is working. So eventually in the future, we are planning to establish a very good collaboration with them. We'll not stop. We'll have in the future more consultative workshop and work on it. ሄኖክ እጁን አንስቷል መሰለኝ። እንግዳ
Can you hear me, Dr. Yonas?
Yes, yes.
Oh, I'm sorry. Like I was speaking, but I was muted.
You're muted.
So thank you. We are left with 14 minutes. A couple of people raised their hands, and there are questions on the chat box. So I'll try to summarize the questions and present. So the first question is from Raquel from Family Medicine. She said, I wonder whether you have any thought on the inclusion of spiritual literacy or understanding of exploring patients' health belief and worldviews in undergraduate and postgraduate medical training, and any suggestion for how, as educator, we could take this forward. So this is the first question. What do you think about like incorporating spiritual model of understanding illness into the undergrad and postgrad education?
I think it's very important because if we are if you are preparing students to serve in Ethiopia, which is a very highly religious country, so spirituality is very important. Religion is very, very important. Without spirituality, without religion, it's very difficult to give a proper kind of service. So our undergraduate students and our postgraduate students, they have to have a very good knowledge of spiritual or religious activities in their context, in the context of Ethiopia. I wish the curriculum also should able to include this kind of topics and titles. But before we push this, I think we need to produce more evidence. We have to do research in the area of family medicine and traditional healers, in the area of psychiatry and the traditional healers, in the area of surgery and traditional healers, orthopedics and traditional healers. So we need to create more evidence in this area. Then based on this evidence, we can argue so that the curriculum should include some traditional healing knowledge and kind of thing. So that's my opinion.
Okay, thank you. So another question is from Brooke Fanta. He's a psychiatrist. So he said, is there a chance to expand this project practice elsewhere in Ethiopia and make the discussion with the spiritual leaders, healers at a national level? I think this would bring about a systemic change. So the same question from another participant said, is there a possibility of scaling this up? One, so you are scaling up to another religion from holy water to mosques and madrasas, but like, can we take it higher up and expand to the entire nation?
Yes, yeah, I think so. That's why we try to do research. That's why we try to produce evidence. So this evidence will help us to sell the project. Will help us to sell the collaboration. So we want regional psychiatrists to replicate this evidence. We are very, very happy to share our experience, though it's published, but we are very happy to share our experience. So I remember in from Bahar Dar, psychiatrists from Bahar Dar, they came to us, shared their experience. They also visited the holy water sites, and I think they were attempting to open similar outreach clinic at holy water sites in Bahar Dar. I don't know currently what happened to that clinic. I wish in Gondar, I wish in Jimma, or in other places also, psychiatrists, other mental health practitioners also able to open this kind of outreach clinic and serve the public.
Great. The other question was, what will be the role of other mental health professionals like psychiatric nurses, clinical psychologists, social workers, and so on in this endeavor?
I think there is a lot to learn, in religious healing sites. So there is religiously people are getting a counseling. It's good to go there and learn from them. It's good to go there while the priests try to counsel the patient, a distressed patient, a depressed woman, a suicidal patient. They sit down and talk to them in one-to-one condition. So there is a place for other professionals too, for the counselors, for the psychologists, and social workers. There is a lot to learn, a lot to give also. At the same time, they can do therapies, they can give counseling, they can do also other social service. So the approach is not only medication, it's not giving the medication to the patient. So the approach is very, very holistic. So I think there is a stake for clinical psychologists, for general psychologists, there is a stake for social workers, and they can learn also from religious healers at the same time, and get more knowledge, more awareness about the service.
It's great that you have emphasized that there is a bilateral learning. We will learn from the traditional healers. So it actually hits our narcissism seriously. We think we know everything. So this is very important. Thank you. So the last question from the chat box is from Tetina, and she asked, in your research, how did you find that stigma around mental illness affected help-seeking behaviors? And additionally, what were your findings on the effectiveness of training traditional healers and religious leaders in biomedical mental health understanding, and how can a structured referral system improve integration between traditional and modern healers? So in this what I want to emphasize is the first one is, how do you see stigma, or was stigma a hindrance factor in their health-seeking behavior? The other one, so the main thing is you have already discussed. So the other one is, can a structured referral system improve integration between traditional and modern treatment?
So in the first question, in our study, we found out that most of the patients they left the biomedical service and came to the holy water because of the side effect of the medication. Because after taking the medication, they develop serious side effect. So they dropped the medication and they came to a holy water. That's stigma. That's a very, very important stigma we need to deal. So they abandoned the biomedical service because of the medication side effect. So one of the thing we need to pay attention is, as much as possible, we have to make sure that patients don't develop side effects, because fear of side effect can create serious kind of a stigma. That was the finding. In general, it's known that because of stigma, people, they don't want to get any kind of treatment, including holy water treatment. They want to stay at home. At home. Regarding the referral pathway, I think it's very important to restructure the referral pathway. So the official referral pathway is referral pathway from rural clinic to health center to district hospital, then to a referral hospital, and that kind of pathway is very, very official. But we need to engage religious healers who are working on mentally ill patients, so that they're able to identify patients with mental health problem and refer to nearby health center or district hospital. So how can we do that? We need to engage them, raise awareness, educate them, when to refer, how to refer, kind of things. That's very important. By doing so, we can give very efficient service. We see patients, they identify early, and we can intervene early. And as you know, early intervention has a very good outcome. So engaging religious healers also very, very help, putting them in the referral pathway.
Thank you, Dr. Yonas. So now I will give a chance for people who raise their hand. So the first one is Ismail. So Ismail, you can unmute yourself and ask your question.
Okay, thank you. My question is regarding the integration of ART in your service area, in your mental health clinic. As you know, many patients in our hospital are presenting with stage 4 OIs, which is very expensive to treat. And these are chronically ill patients presenting with critical case. So bed occupancy is now increasing with these patients who have defaulted, ART. Most of them are coming from the holy water site. I know that about 13 or 12 years ago, there was an ART clinic in Ntoto area. So they were taking the holy water along with the ART treatment, the ART or heart. But nowadays, some of the patients are really drop out their treatment and presents with stage 4 OIs, like, crypto or meningitis, like toxo, and being dementic and whatever. So is there, an effort, or is it integrated, your service integrated with ART? Those patients who are on ART are likely to present with mental health. Thank you.
Okay, so I think it's fine. Dr.
It's a very good question. This model, our model, can work for internal medicine, surgery, orthopedics, and other disciplines too. The late Abuna Paulos, His Holiness, I remember about 12 years ago, he went to Saint Mary Holy Water sites and advocate for integration of ART treatment with holy water. So general practitioner, nurses, health professionals, internists, they have to engage their patients at holy water sites. So nearby, if there is a holy water, it's good to go there, try to identify patients who are taking ART or who stop taking their ART, so that you engage them, taking the ART at the same time, get a spiritual, religious kind of service. So our model can work. You can take it as an example, as a good practice, and replicate it in any discipline. እንግዲህ እየተናገር ከሆነ አይሰማኝም።
እየተናገርኩ ነበር።
አሁንም ተቋረጠ።
አሁን ሲሰማል? እየተናገርኩ ነበር።
አሁን ይሰማል።
Okay. I thank you for the presentation and entertaining the questions. I think this is time for post-test. The link is already posted, but I'm sharing the link again for the post-test. In the meantime, I would like to thank, apart from the presenter, I would like to thank sponsors, including the Ministry of Health, Zaman Bank, Amref, Browner, Pharmajet, and Bloomberg philanthropists who helped EMA or the GACME programs. So I think there's no more questions. People can respond to the post-test, and anyone who scored above 50% is going to get a certificate with 1.5. I think I'm back, right?
Yes, yes.
Okay, so I think we are winding it up. So thank you, Dr. Yonas, and all the participants for your patience. Please make sure that you take the post-test and scored above 50% to get certified with 1.5 CU from EMA. We also thank the sponsors. So have a nice lunch, have a nice day.
Thank you, Dr. Engida. Thank you, Dr. Yonas, for your beautiful presentation and moderation as well. We are so grateful working with Psychiatric Society. I think this is a paradigm shift, and the participant has gained a lot about this bridging strategy. We are so grateful. I would like to ask the participants to join us also the afternoon webinar, which is on the cost of blindness in Ethiopia, which is very important and eye-opening, how to calculate the economic burden of each disease, not limited to eye disease, but we can infer it to other diseases. Thank you very much. I wish a good lunchtime for every of us. And thank you very much once again, Dr. Engida and Dr. Yonas, on behalf of IMA. Thank you.
Thank you. And we would also like to thank Ethiopian Psychiatric Association for collaborating with IMA and making this happen.
Thank you very much for giving me the opportunity to share. Thank you all. Thank you, the organizer. Thank you, Dr. Engida.